Hi, Dr. Shok here. One of the common questions we get when it comes to breast augmentation is where's the best incision to place the implant? And there are really four options, two of which are really good and two of which are not so good in my opinion. The two that are not used very often for limitations in the ability to put the implant in precisely are the belly button or umbilical incision, which you can imagine making an incision around your belly button and putting an implant under the breast is a little bit less than ideal as far as controlling the placement of the implant, which is the most important issue. So we don't do that at all. There's some surgeons who do it, but the bottom line is you can't get 100 straight good results with that option. The second one, which is not as bad but still doesn't give the surgeon as much control, is the armpit incision. And ironically, people who want the armpit incision do that because they don't want an incision on the breast. But if you've ever been to a gym and you've looked very carefully, that incision is more on display than any other option. And when someone raises their arm, no matter how good the surgeon is, sometimes the incision in the armpit's visible. So that leaves us with the two most common options, which give the surgeon the most control over placing the implant, which is the whole point. And ironically and beneficially, both those options allow for future surgery or revisions. Those options are the incision around the edge of the areola, the dark to light color junction from about 4 to 8 o'clock. The downside of that incision is that you're cutting through the tissue of the breast. And if you use the other option, which is the most common one, a small incision underneath the breast or the inframammary fold incision, you don't cut any breast tissue and you can slide underneath the breast tissue or the muscle without cutting any tissue, and that's beneficial because it's not quite as aggressive. And if someone potentially wanted to breastfeed, you would know if you did the inframammary incision that you have not affected their breastfeeding. So those are the four most common options. Again, the areolar incision around the edge of the areola or the inframammary fold incision are the two most common. The main benefit, you can easily place the implant with precision, and if you ever need future surgery, you can go through those incisions. Hope that's helpful.